Hello, hi, very good morning. I'm Farhan. So today I would like to discuss a bit about the topic tennis elbow, or we call as lateral epicondylitis. So actually the tennis elbow is one condition is the painful condition. Will occur for the athlete or individual which involved with the repetitive movement of the wrist extension and also the elbow extension, such as tennis player and also the badminton player and also the squash. The anatomy of the tennis elbow itself, actually elbow is consists of the two part. We can divide from the upper arm and also the forearm. For the upper arm, there is a consists of the one bone, which is humerus, and then the lower arm is consists of the two bones lah, radial and also the ulnar. So for the tennis elbow problem itself is occur at the lateral epicondyle, which is the lateral side of the elbow. This region is got what we call this as several muscle was attached to the lateral epicondyle bone. There is consists of 5 muscle, which is the first one is the extensor carpi radialis brevis, extensor carpi radialis longus, extensor digiti, and also the digiti minimum, and also the extensor carpi ulnaris. But the most the culprit or the problem for the tennis elbow itself is involved with the extensor carpi radialis brevis. So what is the mechanism of the tennis elbow itself? Actually, it's a overuse injury, secondary to the eccentric overload, such as the gripping and also the wrist extension of the common extensor, particularly in the extensor carpi radialis brevis. So, which as I said earlier, the etiology is can caused by the repetitive movement of the wrist extension, gripping, and also the elbow extension. So other than that, the what we call the work of the individual, such as the carpenter or the plumber and also the painters, which is use a lot of movement of the wrist extension. Like a painters, they want to paint the wall, then so they keep it repeated the movement of the wrist extension. Same also for the carpenter. They during the using the hammer and also the plumber. So other the etiology is age. So between some literature said is common occur between the age 30 to 50 years old lah. And then other the etiology they said because the idiopathic, which is unknown causes. So what is the clinical presentation of the tennis elbow? Usually of course, the pain was the complaint of the patient. So when the patient come with the pain over the lateral epicondyle or the elbow, so we must get the further history of the injury. So we must ask about the overuse history or the suddenly changed unaccustomed activity involving the repeated wrist extensions. So other than that, is it the individual or the patient have abnormally intense changes of the workout or activity? And then is it have a history of lifting heavy object with the wrist extension position, or doing the backhand swing tennis training for the tennis player? So other than that, the pain usually occur at the lateral epicondyle, which is the lateral elbow. For examination, we can get the pain about 1 to 2 cm from the lateral epicondyle, and then along to the extensor muscle. Okay, so sometimes patient may have a pain radiating until to the finger digits lah. So the movement of the wrist extension will be limited because of the tender, because of the pain. So if a patient have the tennis elbow itself only is rarely associated by the numbness of the or the tingling sensation for the finger digits lah. If I have a sensation, if I have a numbness sensation or tingling sensation, we must think it's about the nerve entrapment. So for the diagnosis, to diagnose for the tennis elbow, we just go for the history and also for the clinical examination. It's rarely to use the imaging or imaging of other modalities. So unless we want to look for the rule out for the fracture, we want to rule out for the degenerative changes, or we want to rule out for the tumors, and also we want to out for the bursitis. So we can go for the X-ray, we can go for the ultrasound. Other than that, if we thinking is involving the stress fracture or involving the tear of the muscle, so at that point we need to further our investigation with the MRI. If the problem was involved with the nerve, which is reduced sensation, so the EMG or nerve conduction study will be benefit for the patients. So what is the treatment for the tennis elbow? The tennis elbow treatment can be divided into the non-surgical and surgical treatment. For the non-surgical, as we know, first line treatment is as a icing, regular icing, and also for the rest. Other than that, we can top up with the medical treatment such as NSAIDs to reduce the inflammatory process. We can prescribe to patient the ibuprofen or Voltaren, or other than we can give also for the Celebrex. Beside that, we can also add on with the muscle relaxant. Okay, so we can also refer for the physical therapy such as the exercise and also stretching of the forearm muscle, and then we can also thinking about the steroid injection to give at the particular area, or the PRP. Okay, PRP is a platelet-rich plasma. So if the non-surgical treatment or conservative treatment is not benefit or not shows no improvement to the patient, we must thinking the other cause. So the interval time we give between the 6 to 12 months. So after the 12 months, if the symptom is still not relieved, so we must thinking about the surgical intervention. So for the surgical intervention, we must refer to the ortho surgeon. So they might have to do the open surgery or arthroscopic surgery to release or to debride the pathologic tissue and promote the healthy bleeding and also bony back tissue to stimulate the healing process. Okay, so the prognosis for the tennis elbow itself is usually good. Literature says there is show 80 to 90% of successful rate if patient going for the surgical treatment. So what is the prevention or patient education we can give for the patient? So the first is we must advise the patient to avoid end range of motion extreme in the both flexion and extension of the wrist. Other than that, we can also avoid ask the patient to avoid repetitive extension, either the hand also the wrist of motion. Then letting also try to avoid to letting or lifting the heavy items with the arm in the fully extension. Okay, so yeah, I think that's all. Thank you for your time.